So thank you very much indeed, Dr. Trivedi, for joining us today and sharing your expertise in managing seasonal flu jabs and vaccinations at your GP practice. We really do appreciate it. I guess the best thing to kick off with is our first question here. Would you say it's more important this year than ever for people to get their flu vaccinations?
Yes, I think it's absolutely important, and it's probably imperative that people get their flu jabs this year. I mean, year on year, we've always vaccinated the vulnerable population, but I think if what the last 2 years has shown us, respiratory illnesses doesn't just affect elderly patients, and it can sit there and take down anyone from any age. So vaccinations are now opened up for younger age groups and everything too for the flu vaccine, and I'll strongly encourage as many patients as possible to engage with it moving forward.
Fantastic. And what challenges have you faced in the past with inviting people for flu vaccinations?
So I think prior towards COVID, one of the big aspects was vulnerable patients, and that involved naturally popping into people's homes or bringing them in smaller batches compared to filling the waiting rooms. This past year's flu vaccine period was a much different experience because naturally you can't have hordes of people coming into the surgery. Things for us, we opened up everything in our car park. We had tents erected, queues staggered out, 2 meter gaps wrapping around the corner. And I think on the most part, our patients probably enjoyed that experience more than they did before because it turned into a bit more of a social interaction in itself too, to, even while waiting in the queues, and you get to see familiar faces. And I think they enjoyed it a lot more. And so this year, I think from what we've learned is that whatever we end up doing, we want to at least make sure the patient experience is a much happier one this time around compared to the previous years, really.
Interesting. Yeah, I've been through that particular snaking queue system a couple of times for my own
What?
COVID
Right, yeah.
for my own COVID jabs
Yeah.
this year.
Mm.
Um, so with given that sort of scenario as well, a sort of extra question here. Do you think it's important for patients to be able to decline an invitation and have that record onto their notes for declining a flu jab?
Of course, I mean, I think whilst we as clinicians encourage patients to have their vaccine, and us clinically, through scientific evidence, are able to explain the reasons why it's important to have a vaccine, I think it's very important that patients still maintain their autonomy in regards to that. And there's many reasons why patients may not want to have the vaccine, or may not feel that it's to be safe or it's not right for them. And as clinicians, obviously, as much as it may not seem that way, we're very impartial when it comes down to what decisions we make. And if a patient chooses not to, then I think that's important too. But equally so, it's important that us as clinicians document that into their notes, so that number one, we don't keep harassing them year on year if that's not what their intention is. But more than anything, God forbid, if something does happen, at least we know what medications or treatments we've given and what we've not. And sometimes that's equally as important, really.
That's really interesting. Yeah. You mentioned you mentioned about how things have worked this year, and I joked about going through the COVID vaccination queue myself. Obviously, at the moment, we're going through a period where the booster is now on its way as
That's,
well.
that's right, yeah.
Yeah. So with COVID vaccinations as well, this little booster jab that's going to be coming possibly at the same sort of time or close to it. What challenges do you think you'll face this year with possibly those two things happening?
So I think when you put the two things together, the big things that come to mind is number one, funding and resources of having somebody, administering each of those. Now, periodically, whenever we've given our flu vaccines, we've tried to factor in our pneumococcal vaccines for our over 65s at the same time. Now, and at least time them in so that we're at least able to give them that vaccine at the time. On this occasion, though, when we're talking in COVID vaccines, obviously the boosters are primarily for the vulnerable patients more so. But when we're talking about administering 2 to 3 potential vaccines in such a short period of time, it is going to be very, very challenging from a resource perspective. And I don't think many areas are being funded extra for. This act is mainly clinics and surgeries going out of their way to protect their communities in the best way possible. obviously one of the contraindications of the COVID vaccines that you can't have other vaccines very close to us, so they've got to be staggered apart.
Hmm.
And that's probably also going to come down to a resource issue on how we execute that. But I think a lot of people at our local COVID centres and our directors in our PCN are doing a fantastic job in orchestrating the right way to execute that. So hopefully it should be equally as smooth as the vaccine program's been for the flu last year as well.
Yeah, absolutely. I think it really did demonstrate, didn't it, what can be achieved, and
That's right. Yes.
what the surgeries can do when they put
Mm,
that together. Yeah, and on that sort of subject as well, practices looking after their patients,
mm,
going out of their way to make sure they're okay. There's this other side of it this year as well, with the misinformation of COVID
of course.
vaccinations and
Yeah.
vaccinations in general. Do you think that's going to have an impact on flu uptake this year?
I think I don't imagine it to have an impact on flu uptake, but I think that there's going to be a very big blurring of lines in regards to what vaccines patients are being given. I know that some patients are going to ask saying, "Is this for my COVID vaccine booster? Is this for my pneumococcal? Is this for my flu?" And when you've got three different things which potentially might be happening for a potential group, it makes a big difference. There's obviously a lot of you call it propaganda, which is out there in regard and misinformation about the vaccines, which has come about, and naturally that's going to probably have a very big impact in itself too. And also for a lot of patients who had the COVID vaccines, they have had unfortunate side effects. They've had fevers, body aches, pains, and for a lot of people, having that twice, thanks to the first dose and the second dose was bad enough. But when you then start presenting in a booster, I think there's naturally going to be an element of aversion for a lot of patients there, but it's important that we do that so that we can keep everyone safe and healthy.
Yeah, that was a really interesting point you made as well about the sheer amount of things that might have to happen and that people might be receiving multiple
Of course,
vaccinations and jabs, and how important clear information and speedily
of
delivered
course,
information is going to be important.
that's right. Yeah.
Excellent. Okay. Now, to pick up on something you mentioned earlier as well, the increase in different cohorts that are going to be invited for flu this
Mm,
year. We're expanding to include children up to 17 years old as well. Will this present
mm.
additional challenges for you this year?
To some degree, I think it depends on which way the tide turns for our local population and probably for most areas. I think we've had phenomenal support by local public health teams as well as our local integrated care hubs and CCGs when it came down to the execution of the main vaccine. And these vaccine centres, which have popped up in and around our area, have been lifesavers for thousands of patients. Now that they've opened their doors to younger cohorts, we're seeing more and more patients which are going to the centres for that as part of a walk-in service. So I think probably by the time it comes down to the winter months, our personal goal for our practice was to try and before the winter month make sure all of our over 17s vaccinated, or at least a large proportion of them, and thankfully we're on target for that. But for other areas where things are a little bit more difficult, a little bit more choppy, I would like to think that the public health teams would probably be stepping in to maybe even consider assisting schools to executing some of the vaccines, having more and more of these vaccine hubs popping by. And I think all over social media, we're now seeing more and more places where they're saying, if you get your COVID vaccine done here, then we'll give you XYZ incentive, which kind of makes me a little bit jealous, really. I wish they had that when I had my first dose. But, yeah.
Indeed, yes. Very good points, and I think they must be good points because Scott's nodding along sagely. So if Scott's nodding,
Of course.
it's all making sense. Um, a slight sidetrack question then. The flu enhanced service specification now requires patient ethnicity data as well to be
Mm,
collected.
mm.
How were you looking to achieve this at your practice?
So our practice is actually a very ethnically dense population. Probably about 60-70% of our patients are first generation immigrants or the children of. And so we've been encouraged, I think, very early on to record that, even though for a lot of us, we know where that our patients have come from.
Mm,
I think when now more than ever, we know the importance of data collection. We know the importance of how data can be used to help populations. And it's with that that we were able to identify that BAME populations were at a higher risk due to the COVID virus itself. I think recording this information now, making sure that that information is up to date, is now more important than ever, because whilst we all may be humans, we all have the same rights. All of us are genetically designed a little bit differently,
Mm.
and thanks to medical intelligence and data analytics, we now can start using that like information to make sure that we're providing even better healthcare than we have done before. So to any patient or anyone who is a bit apprehensive or a bit unsure about should we allow our practices to do that, remember it's so that we can provide the best medical care for you as an individual, and it's not for any other weird little Facebook project which or anyone else might be trying to chase after. So yeah.
Exactly. Yeah. No. Excellent. Now, just two last questions to go. The
Mm,
JCVI has advised that there should be no problems with vaccine deliveries in time
mm,
for flu season this year.
mm.
Is that your understanding too?
Yeah, at present, that's our understanding. I remember last year there was a stage where there was a slight shortfall for some vaccines, and we had some slight delays at first. But we've always found that they've been fantastic at providing a full dose of vaccines in a large quantity for whatever we've needed, and that's worked out very, very well for the practice for most local practices. Um, at the same time, we always do our best to make sure that we've got provision for that. So our priority is always to vaccinate people based on their clinical priority of how vulnerable they're going to be, and ensure that they're vaccinated first and then trickle down our lists. And if anybody else would like a flu vaccine, it's always important to mention that most pharmacists locally are going to be offering the flu vaccine too as well. Thanks to COVID-19 projects which have been in and around areas, you're probably going to find that local services are going to be doing the same thing as well, where they'll highlight to you where you can go in for a walk-in service for a vaccine if you can't get an appointment with your GP.
Yeah. Fantastic. Okay.
Mm.
Yeah, and with things like that, those local services, then a messaging system to let patients know that that
Of
is an
course,
option
yeah.
might be useful.
Mm.
Do you see my segue there? Again, we
Of
can edit
course.
this out.
100%.
But thinking of the challenges that we've discussed here and your experience with our MyGP Connect system so
Mm.
far, how you've seen it, how you want to use it, how are you planning on using the MyGP Connect system for flu season this year? What do you want to get out of it?
So I think our role of tying in my GP is probably going to be where we're really, really hoping that we can sit there and start incorporating the app into patients' lives regularly. By being able to sit there and message patients in a bulk to highlight that they're being invited for that vaccine is going to be a savior in itself too. It's hopefully going to decrease our administrative burden for our staff drastically to be able to highlight, yes, you're being walked in and this is a walk-in clinic and this is what you can do on this day, and getting things scheduled. Even when it comes down to appointment scheduling for their vaccine, we're going to start trying to incorporate the app to be allow patients to actively book on themselves once they've been messaged.
Mm,
And fingers crossed that works out to be very, very fruitful when we do that. But more than ever, given the fact that we've got these multitude of different vaccines and different treatments that we're offering, especially tying in things like COVID booster, I think sharing information with patients about the risks and the benefits of each of the vaccines now with an app such as MyGP, the more patients we have onboarding with yourselves, the better it will end up being in terms of being able to message these patients, because we can send them reminders saying, you've not had your vaccine, remember these are the risks, this is the reason why we're doing something. And sometimes that little nudge is all a patient needs in order to say, actually, you know what, this is for my well-being. I need to get up off of whatever I'm doing, take a bit of
mm.
time for myself and get the vaccine done.
Absolutely, yeah. And it's something that we've had real world success with previously with our cervical hub screenings, where that little nudge to get a text message to go for something like a cervical
But,
screening has saved lives as a result. So
mm.
hopefully we can do the same thing again for you. Um, but otherwise, I think we've taken up enough of your valuable time.
Oh, just one question.
Oh,
Maybe
Scott, yes, go for it.
yeah, sorry. Just one question occurs to me as we were going there. Thank you. They were brilliant responses. They are really, really impressive and valuable to us. That information. One question I just wanted to ask is around what are still the unknowns in terms of vaccine delivery this year. I mean, we closely follow the advice coming from NHS England and from JCVI and so on. And yet it still to us seems a little contradictory. You know, they're saying that the Green Book says that you cannot issue COVID vaccinations synchronous with pneumococcal and with flu. Yet we know that many practices are planning to do exactly that, and in fact, even in the advice, it kind of says that they expect you to do the same. So there seems to be that contradiction there. How do you think there's still uncertainty around that?
I definitely think so. I've sort of mentioned from the start that I think the COVID vaccine, being a new vaccine in the way that it is to some degree, is still fairly, I would say, quote unquote experimental. We know its safeties to some degree, but how it's interacting with other medications, that research is still only coming about right now. I think for lots of practices, I know our practice in particular, we're trying to strategize a way where we can essentially administer each of the vaccines this winter or this autumn, preparing for the winter, but by giving enough time in between each of the vaccines and how they're being given, so that we can make sure that we're not really getting in touch, we're not really getting those interactions that we're hoping for. But I think the biggest crux, I mean, the influenza and the pneumococcal, we're not as worried about, because that's something which, we've known about for quite a while, and we know the risks and the benefits for that. But when you're bringing COVID vaccine into that, that's going to be a bit of a game changer there, because periodically we've always given 3 to 4 weeks, or ideally 4 weeks gap between the two. How to factor that in such a short window so that you can provide that booster cover, as well as keep them safe throughout the winter. I think that's something which I probably might have to come back to yourselves about and touch base yourself once we've got a bit more clarity in regards to what we're going to do locally too. But that's still, we're still sitting there trying to juggle the balls there ourselves at the moment.
My suspicion is you're going to need a bit of a whiz kid on your clinical system search and reports to manage all of these different cohorts and bringing them in at the right time.
That's exactly it. Yeah.